Well, hello there. Welcome to my presentation on the my internship experience. I apologize for the lack of visual of the poster in the video. I'm not super tech savvy. Life is caught up to me, and this is kind of a last minute thing. So I apologize for a the that and b the lack of proper attire for this presentation. But yeah, without further ado, my name is Dallas Dixon, and this is my presentation on physical therapy versus physician assistant and which career path may be the better route to go for future endeavors, so to speak. Um, Start off super basic stuff. I interned up in Coeur d'Alene, Idaho, at a place called Orthopedic Physical Therapy Institute, or OPTI for short, which is a sister company under the same ownership of OSSM, which is the Orthopedic Surgery and Sports Medicine, which is the main clinic. Those are located within 5 minutes of each other, so people go to orthopedics and get a referral for PT from there, or just go drive down 5 minutes and schedule their appointment. So it's really convenient, kind of being in that within 5 minutes of the main orthopedic surgery site and the PT site where I interned at. My supervisor, his name was Joshua Stibb. He has a doctorate in physical therapy, as he has his athletic training certification, and he has other certifications that help with his practice, such as dry needling 1 and 2, and then He's permitted to use grass and metal tools, and those are kind of comes in forms of either like longer like curves or like brass knuckles, and they're just used to free up tight tissue, is what they're used for. The immediate supervisor, other than Josh, was Brian Shear. He was the gentleman I was supposed to intern under originally, but he tore his Achilles, and kind of just went from there. Um, Overall, my internship, I learned a lot of how the inner workings of physical therapy work. Um, like how insurance is billed, because they have to bill in units, and each unit for care goes for like 15 minutes because they're only allotted half an hour with their patients, and then the techs will take over after that if need be. So kind of learning like in the organs, like how they bill insurance. Kind of learning about how insurance works, like because insurance has to approve visits, and they can only do so much, and however many visits they have, and it's always a fight to get more visits approved. Is the long and short of that. Learned a lot of different ways to modify exercise for therapeutic purposes, other than the kind of common of like elevating the heels for a squat. Um, Kind of along the lines of, say, if someone has a hard time with a TRX squat, you putting a chair behind them, they can rest in. That way they can take a breather and then perform the concentric phase of the movement. My main take, and I wanted to do this presentation, this project in particular, because I was torn on what I wanted to do for a living, whether it's physical therapy or physician assistant. Both crossed my mind, and Dr. Ford in KINES 480 fall semester, he mentioned that the cost of tuition for PT school keeps raising, while the cost of how much you get reimbursed from insurance is continually decreasing. So there's ever growing gap. And that was kind of another thing that's definitely a thing that stuck out with me. And my supervisor agreed, and he says that he loves the way he does, but he just hates that he can't recommend it to anyone. That's the main issue there. And I talked with a couple other of the therapists in the clinic, and including the clinic director, Tyler Baxter is his name. And he said something that really stuck out to me, which was, as a PA, you are essentially paying more for liability insurance because you have so much to be worried about. As a generalist, you know a little bit about a lot of things. More of a PT is more specific, so they know a lot about a little amount of things. But also, it's the amount you get to know people. That's his big stick. Where it's like, as a PT, as a therapist, you have so much time to get to know people and get to know their story. Whereas a PA, you maybe only see them once a year and maybe have like 30 minutes with them at that, maybe. So my main conclusion from this project was if you want to go one route or the other, you have to A, be prepared for the increase or decrease in liability insurance, prepare for the financial gap, see how often do you want to get to know people is the main thing. How much time you want working with people is really the ultimate thing that falls down to for me. Personally, I've decided that I'm not going to go the physical therapy route, and I want to go more the strength conditioning route because I want to train athletes. As much as I like training general population, I like working with athletes a lot better. So I think that is the call for me. That's pretty much it. Thank you for watching, and God bless.